what more could the government be doing? And, I know it's probably going to be very expensive. And for a budget hawk like me, it might be hard to swallow, but I think we can pay for it. So what would be the investments that we should be making?
Well, let me take a step back and actually try to break this apart, I think, in some different segments, because it surely each merit their own consideration. Let's take healthcare. The big limiting factor in healthcare that has caused healthcare system to go from breaking to breaking from bending was, in fact, not enough personnel. We didn't have the trained healthcare workers we needed, and that is a systemic issue on salaries for nurses, even doctors, support individuals within the healthcare facilities, healthcare systems. And so we have to look at what is the long-term training program support? What is the kind of financial support we have for maintaining a robust and expandable healthcare system? We don't have that right now. A lot of people think it's beds, a lot of people think it's drugs. They're all important and they can be a challenge. But right now, that's not what has driven the number of healthcare systems in this country to literally start to break. So we have to take a step back and look at what should be our healthcare/disease care system over the course of the next decade. How do we build that? How do we have resiliency within that? The second thing, though, I think that's a challenge, and this is where Omicron really has illustrated this more than the other variants, is when you have a very highly infectious agent sweep through a community for 4 or 5 or 6 weeks, you bring the economy, you bring life as we know it to its knees. I mean, we have seen over the course of the last 3 to 4 weeks absentee rates at work 30, 40%, not only in healthcare, but in every other aspect of our lives. That's why garbage isn't getting picked up in a lot of places. That's why pharmacies have been closed 2 and 3 days out of the week. That's why we see so many aspects of first response being delayed, if not even available. And I could go through a laundry list of all of these things. So I think one of the things we have to ask ourselves is, there's an old oil frame commercial from many years ago that was on TV that said, you can pay me now or you'll pay me later. So the question we have to ask ourselves, what is the investment we make to build up and sustain the infrastructure so that this doesn't happen again? Take this off the table. The final piece I'd add, and I think, Bob, this is really an important point that people are missing right now. I think the wild card that is yet to really set the final agenda for the world economy and COVID is China. I think China right now is on the brink of potential major failure. Omicron has so changed the transmission characteristics of this virus, meaning much more highly infectious. China, and what I would call their draconian public health approach to dealing with COVID, have done a pretty darn good job of controlling it for the last 2 years since Wuhan. And it's meant shutting down, locking down major metropolitan areas of 14 million for weeks at a time with just very few cases. If you look at their numbers, they are sure a lot better than ours, but it came at a real cost. Their zero COVID policy cannot be sustained. Omicron is the wind. You can deflect it, but you can't stop it. And I think what you're going to see happen over the course of the next 6 to 8 weeks is in China, there's going to be more and more widespread Omicron transmission. They are going to, because of zero COVID policy, try to shut things down, major geographic areas. And with that, they're going to shut down manufacturing. Many of the supply chains that the world depends on will be unavailable, more so than any time during the pandemic. And I don't think they're going to be quick to relent in their approach to this kind of zero COVID policy. I think that is a huge, huge economic issue right now. Imagine from a global supply chain basis if much of China starts to shut down. Now, finally, I'd say, well, hopefully they can do better. But it turns out that the 2 vaccines that they have brought forward, both the Sinovac and Sinopharm vaccines, appear to be relatively ineffective against Omicron. So here they have this large vaccinated population, which is a remarkable accomplishment, but with vaccines that may have very little impact on who gets infected, who transmits the virus in China. So I think from an economic standpoint, those are not ripple effects from China. That could be one major tsunami economically. And I don't think the world sees it yet.
No, and I think that that's a nightmare scenario, particularly when you think about the supply chain implications around for the global economy, which is already stressed to begin with. In the new normal, raises a question. How do we deal with that? I mean, we can't convince China to change its policy, and I think that that policy is unsustainable. In that sense, do you look for alternative supply chain options, or prepare that way?
Well, I think China may not change, but they're going to have to change because I don't believe it's sustainable. So at some point, the system will fail, or they will decide that they are going to elect to take another course and somehow deal with this national pride issue, whatever. I don't know. But I think in the meantime, the rest of the world that is so dependent on China, for example, we in this country, many of the life-saving critical drugs that we use every day are generic drugs that actually come largely from China. If that shuts down, the collateral damage will be huge. And so I think that they may have to fail to ultimately change, but the cost will be huge to the rest of us. In the meantime, it's not possible just to suddenly overnight develop new supply chains. You can't do that. But every company in the world has to ask itself over and over again, as part of its due diligence, am I highly dependent on Chinese sourcing for critical elements of whatever I do? And if they are, you better be prepared. So I think that's the message that we have to get out right now is, you can't avoid the Category 5 hurricane, but what are you going to do to be better prepared to protect life and physical structures as much as you can?